Since the spring of 2020 and the start of the COVID-19 pandemic, the healthcare heroes and healers at Riverside have bravely risen to new challenges, going above and beyond to care for others as we would care for those we love.
I think one of the greatest challenges when the pandemic first began was the unknown.
In the earlier days when we were just hearing about what was there, our only vision was in New York City or over across the ocean. And so we at that time didn't know the true impact. What does this mean? What would this mean for our nursing facilities and our residents that we love dearly, or our team members or volume? I mean, there was just so much unknown.
Our first response was really to prepare our staff. If we do have an influx of patients, how are we going to take care of patients safely?
We were meeting with a radiation oncologist in a conference room, and we were talking about what some of the things we were saying. You know, you couldn't leave the state, how we had to start implementing these precautions. And it was just incredible to me how one of the doctors said, "Oh my gosh, it's too late for that."
As you think about how COVID impacted Riverside and Virginia and the country, it starts with how our team has responded. They have stepped up each and every day.
Our team really came together, working to support each other, to try to take care of patients at a time where there was a lot of uncertainty around COVID.
So I was really struck by how the clinicians and the physicians and the nurse practitioners and the PAs were constantly taking in new information and responding accordingly to provide terrific care.
The way that Riverside responded to the pandemic has been remarkable. Our leadership team has done a phenomenal job in ensuring that we stay at the forefront, not only from clinical care, but also the way that we approached our patients and also our team members.
No one knew that 2 years later, we would continue to see challenges walk through our doors at the same level or even higher than 2 years ago. And our team members are here for it. They are here to take care of everybody who walks through our doors, but that doesn't mean they aren't tired, and that doesn't mean that they aren't scared, but they show up every single day.
The history of Riverside that is so strong, its legacy, its 100-year, plus commitment to the community became stronger during the pandemic.
Our honorees tonight are really the embodiment of all of the things that have gotten us through the last 2 years. It is expertise in the hospital in a clinical setting. It is saving your life. It is having the talent and skill and will to do better and be better. It is education, being a lifelong learner, understanding that it never stops, that we must continually push ourselves to be better for our community. It really is about prevention, that if we do the work on the front end, we can save lives. And then it is about hope. The people who know that philanthropy fuels hope and healing across the communities we serve.
It is indeed an honor to add my congratulations to the entire cast for commitment you have made to be the strong builders, leaders, philanthropists, and keepers of the Riverside Way, especially for my long historical view of how a group of doctors started a school of nursing in a 50-bed hospital on Huntington Avenue, and it became the Riverside health system that it is today. How fitting a backdrop to highlight this celebration that honors leaders who have built the Riverside Foundation into a remarkable philanthropic powerhouse. They are being honored in part because they honor every individual employee who works there. They know it is only with each member of that team is Riverside Way possible, and is Riverside a true family.